Welcome to the 2022 Breast Cancer Rehabilitation and Wellness Summit. My name is Denise Stewart, and it is my honor to talk with Beth Hoag, physiotherapist or physical therapist from Ontario, Canada today. And why it's my honor is that she's talking about the same thing I talked about at the summit, but from a completely different view. And that is what this summit is about: is taking a thing and then getting different perspectives, which means that you have more than one option to get some help if you've got this problem. And so the topic is rib changes, ribs, all those ribs that we've got that we've got in our body, our rib cage. Beth is going to be talking to us about those as a structure. Welcome, Beth.
Hi, thank you for having me back this year.
Hey, Beth. We've talked about in the summits before about shoulder dysfunction, about cording, about scar tissue. Ribs is kind of just a new kid on the block for some and is probably still around the corner for others. So why are we looking at ribs?
Yeah, I sort of joke. I feel like I my two areas of passion are the no man's lands, the pelvis and the ribs. but the ribs, we're talking about the ribs because we can't ignore them. They're such an integral part of the shoulder and the shoulder girdle, let alone the rest of the body. And I think historically we've sort of been trained to we sort of put things in silos, but the reality is that's just not how our body works. And I see a lot in the breast cancer world, a lot of talk about the shoulder, but far less about the role of the ribs and the integration with the clavicle, the shoulder blade. And we're not going to get into all that because we can't in one talk. So I wanted to hone in on the ribs and talk about that because I feel it's so important. Sometimes you see people just don't quite have that last little bit of range of motion or that cording that just won't let go. And often one of the missing links, hey, it's the ribs, and we've forgotten about them. So I like to talk about them.
Beth, what are some of the things that people might experience, but might not kind of think that it's the ribs' job? What would you see?
Yeah, so I mean, my background's in orthopedics and sports, and then I've carried over into oncology world. And the common things that we see is shoulder range that either you just can't quite get there, or there's all sorts of hitching and cheating going on. Now, not everybody notices those cheats. I always point them out to people, but they don't necessarily notice those. So what people might notice is that they don't have the shoulder range, or often the common one, if it's the right shoulder and they're the driver, I can't reach into the back seat of my car. Well, it's not, and they're focused on their shoulder, but that actually requires a lot of thoracic rotation in order to be able to do something like that. So it's more those functional pieces that involve some rotation or nearing end range shoulder motion that people often come in saying, this is why I'm here to see you. And then I point out what the heck is going on in the ribs. And they go, whoa.
Now, Beth, I'm just going to use the word turning because that's the word I used, and because rotation is just such a physical therapist word. So,
Okay.
so turning. So, if you're finding that your turning feels a little stiff, then that's what Beth is saying is rotation. So,
Good thought.
how are the ribs connected to all of these things where the person thought that they only had a surgery at the breast?
Right. So I think the ultimate connection is through the fascial system, the myofascial system. And I know you and I have talked about this before, and we both agree with this so strongly, is that the breast cancer treatment really wreaks havoc to the fascial system, right? Through surgical scarring, post-surgical scarring, and radiation is a really big doozy. And that really starts to impact our system from sliding and gliding, but also those ribs that sit below the breast or where the breast used to be. And so we know that with movement of the arm, because that's usually what women are trying to get back, we know that the ribs, if you think about the ribs, I'm going to use a term from one of my mentors, Diane Lee in Canada, and how we have this connection in the front through the sternum or the breastbone, and then those ribs wrap all the way at the back into the spinal cord, spinal column. So we talk about sort of a ring. Think about it that way. Well, these ribs or these rings, they have to tilt and rotate as, or turn, pardon me, tilt or turn as we move those, our arm in this example, whether it be the arms together or separately. So what starts to happen is that fascia starts to adhere and glue to the, including the ribs. It not only, I find, I don't know about you, Denise, but big rotations start to happen through the whole thorax after breast cancer treatment. For I honestly would say I have yet to see a woman in my 13 years that hasn't had had rotation. Hey, it happens to everybody, at least everyone that has difficulty, in fairness, because that's why they're coming to see me. So we start to get these twists in the thorax, in the whole rib ring system, and that starts to mess up the shoulder mobility. So when I'm looking at someone with mobility, we're looking at those twists, but we're also looking at compression. If we think about the ribs like a slinky, right? This is sort of pre-breast cancer. And then over time, those ribs get pulled and pulled and pulled together. And so there's not going to be as much movement there free to have. So we work on trying to get space through the ribs, as well as get that mobility back through the ribs as well, or the rings, if you want to call them that.
Fabulous.
That was a long answer, but
oh no, I like the slinky. Everybody wants a slinky rib cage.
Me too.
I'm working on it. I'm working on it. So Beth, have we got some checks that people can use themselves to see how their rib cage, whether it's a slinky or not slinky?
Yeah, whether it's I love it, whether it's a slinky or not. Yeah, so some of the, I mean, this isn't going to tell you much for someone who doesn't have the knowledge, right? It tells you and I a lot. But what I'll often say with ribs is sort of two checks. One is our ribs have to, all of our ribs together with our spine, that whole ring system I talked about, all has to turn together in this sort of symphony. So what I often have well, I'll check with women, but easy way to check is to check what your twist is. So if you put your hands on your shoulders, so that way you're not cranking through your shoulder blades in your shoulders, and you're sitting down so your pelvis is stable. And then check how far can you rotate one way. Think about, and don't force through it. How far can you go without muscling through it? Because if you're muscling through it, guaranteed you're cheating. And how far can you turn the other? Like I'm quite restricted one way. So how far can you go the other way? And that in and of itself will start to give you some hints. Okay, I'm not saying it's just a rib or a ring. There's a whole lot that can stop that from happening, but that's an easy, quick way. Frequently what we see is the turn is restricted on the side of the breast cancer. So let's say we had left-sided breast cancer. Often that turn to the left will be restricted. Now, I'm not saying everyone's going to be like that. There's differences, but that's the common pattern that I see. So that's number one.
Before you go to number two, let's add in, just make it a little bit, while people are playing with that, you talked about the hands, but also when they're doing it, have a check to see what their sit bones are doing too. And yes. So that's the other little thing that people can unintentionally do. If you look at the first point where the sit bone on the other side, so this side on my right side, when it comes off the chair, that's cheating. And so both sit bones, and I know because I am the master of cheating. And
everybody's the master of cheating. Our bodies are brilliant. If we need to reach something there, we're going to find a way to get there, whether it's a good way or not, right?
So sorry for interrupting. Let's go to number two.
No, not at all. That is a perfect point, right? And that's perfect. And then number two is a little bit more complicated, but I often talk about sort of bumpy ribs. And again, this is some of my training with Diane Lee here in Canada. But looking at, again, if we go back to the slinky analogy, okay? Ideally, no one is ideal, so if whoever's watching this, don't panic. But ideally, our ribs, if you will, should be all sort of stacked and lined nicely. Well, that's just not life. What we're often this starts to happen, right? Where you've got one or two, I can't, the slinky's too small, but let's just imagine one or two of those are out to the side. So that rib or that ring is in a turned position, slightly turned. So what we can do ourselves is feel down the line of our armpit and feel down and, oh yeah, I feel one or two ribs that are sticking out a little bit more than the other. And that gives us a hint, if I'm a ring, that ring is in a rotated position or a turned position, right? So the way we can do that is feeling just sort of down that armpit line, and the ribs more or less run oh my gosh, I can't find my words, along the horizon, okay? But they do angle, so don't worry about that. But using your thumb and feeling down that armpit line, and you can do it on both sides, is do you feel a rib that, like, yeah, that one kind of sticks out, or oh, that one's a little bit tender too. And that can give you a hint that some of this is starting to happen somewhere through your ribs.
Fabulous. So 2 checks, and let's go. It's best to have 2. If we can't have 5 because people won't do it. So you've only got to do those 2 checks. So let's go into some ideas on improving this stiff rib problem.
So I love to use the breath, all movement with breath, because the ribs have to move when you breathe. They should move when you breathe, okay? So what I tend to do is to coordinate motions with the breath, okay? So meaning that when I take a breath in, my ribs move a certain way. And when I lift my arm up, my ribs should move a certain way. So we coordinate those ways into some mobility work in order to try to get both working together. That's number 1. So number 2 is, again, one that I have learned in my training with Diane Lee. So I don't take credit. I didn't make these guys up. My computer is spinning a little bit, but let's see. I'm going to share my screen if that's okay. This is a technique that I've learned in my training called a ring stack. So stacking those rings and then breathing, okay? So what we're gonna do, remember that twist check we talked about earlier and that rib find, we're gonna put them together, okay? So I'm gonna play it and I'll talk. Can you see the video? Is it working?
Yes, all good.
Okay, perfect, all right. So what I'm doing here is doing that check of rotation like we just went over a minute ago, looking for which way is stuck, and you can see I'm pretty stuck going in that direction. So now I'm going to feel for that bumpy rib on the same side that I have some restriction. So I'm using my thumb, feeling up and down those ribs, finding that rib that's a little bit bumpier or maybe a little more tender than the others. And then I'm going to use 2 parts here. The first part is I'm thinking about creating some space between my ribs like the slinky. And then the second part is using my thumb to very gently turn that rib back a little bit. And then I go into the rotation. And I'm nodding because my rotation should be a little bit better now than it was before I started. So then I'm going to stay at the end of my rotation and I'm going to try 3 types of breath. I'm going to try a breath into my belly. I'm going to try a breath into my lower ribs. And I'm going to try a breath directed up to my upper chest. And I'm feeling for which breath really pulls on that pokey outy rib that I've got under my thumb. And then whichever one that is, I'm going to hold it and I'm going to take 3 of those breaths as I hold that turned position. And at the end of 3 breaths, if I've done it well, there should be a little more wiggle room there to sort of take up the slack. So it's not that I'm cranking and turning farther here. It's just that I've mobilized some of the fascia, whatever is sort of holding on to that rib through my breath. And then I've freed up a little bit more rotation to have there. Okay. So I'm doing this, I'm taking 3 breaths. And I'm seeing if there's a little more wiggle room, picking up the slack, taking 3 more breaths, picking up the slack. And I usually do it 3 times or until you kind of run out of wiggle room. If there's no more room to be had, that's as far as you're going to accomplish with this sort of a technique. And then you come back and sort of shake it out and check it out. So recheck your rotation to the right, and actually that's a little bit better even, and recheck my rotation to the left, and it is definitely better. I was cheating with my butt cheek a little bit there at the end, but otherwise it did give me more range of motion. One of my favorite techniques that I love to do, because it's something that people can really feel in their own bodies. They can really feel the change. Where some people get a little caught up is finding that rib. And I usually say to women, in this population, post breast cancer, it's rarely just one rib. So don't get too stuck on which rib is more pokey outy. If it feels pokey outy, go for it. Okay.
Yep.
And the correction that we're making with our fingers isn't forced. It's a really mild, gentle correction.
So Beth, people that have had a breast implant,
Mm-hmm.
the tight skin presses on the implant, presses on the ribs, and then if we have a breast reconstruction, then there's the big surgery, and it has to change the flexibility of the ribs underneath.
Absolutely. Yeah,
and
absolutely, without a doubt.
and that we can use that exercise because it's well away from an implant. So they're great techniques that people can use.
Mm-hmm. A really gentle technique for sure. Do you want me to show you one more?
Yes, please.
It's a much simpler one. The one I showed you was the most complicated one. Okay, so in this one, remember how I talked about how we're going to coordinate the direction of movement with the breath. So that when you inhale and exhale really matters, okay? And that question I get a lot. So I'm on hands and knees. So this is not a beginner one. You're not immediately post-op. But as you're rocking your bum back towards your heels, you're going to inhale and you're going to exhale as you come back up, because the rib motion with bringing those arms up overhead should be the same as the inhalation. Okay, so this one we are not quite as worried about. Don't do it this way, is my head shaking there. We're not quite as concerned about where we breathe. So I would say go for a good, healthy diaphragmatic breath, and we can talk about that in a second. But we're coordinating that inhale with the rock back. Okay, and that's the other one. Nice. I have more, but I'm going to say those are my top two. We're going to stick to the theme of twos today.
Yeah, exactly. And also just to let people know that it can be simple, that we can get a change quickly, but because there is radiotherapy and because there's scar tissue, you might have to do it more than once. And so maybe integrate it into your whole life. So having simple ones just means that you can do that.
Yeah, and I always say that adding the breath is like the cherry on top with exercises. You can take a super simple exercise like the one I just showed you, and adding the breath work just takes it up a notch, and it really starts to address what's going on in the ribs in addition to so the two I showed you, again, this is just two, right? I've got tons and tons, right? But the concept is we're adding either turning, which is really more complex into, I love doing lots of turning stuff with people. I do a lot. But I also wanted to show something a little more simple, like the one we just looked at, about how you can take that and incorporate the breath into it to put the little cherry on top.
Nice. I'm going to just talk a little bit about the back pain, the low back pain that people often will not talk about when they come into the clinic, but then own up to having it. And that low back pain can often be the result of not being able to turn.
Mm-hmm. Absolutely. It's a compensation strategy, right? Remember when we were talking earlier about our bodies are smart, and if we can't turn using our thorax, we're going to find somewhere else. And our low back structurally isn't designed to twist or in turn. It's just not designed that way. So boy, that can start to cause some major low back pain or neck pain, cranking through your neck instead, or hypermobility through the shoulder because we can't get there, so we overuse the shoulder. Yeah, absolutely. Lots of ways our compensations can come back to knock on our door in a different way.
This is my topic. I love this topic, and so the thing that I saw this morning was a video on, it was an MRI, functional MRI, and it was using nose breath, and the brain actually migrates up with an in-breath and down with an out-breath. Amazing.
Cool.
Which, if we
Beautiful.
get that rib breath happening, the heart moves, and then the organs in the belly move.
Yeah, so that exactly, right. So it's the connection, the pericardial connection, which is the wrapping around the heart to the back of the sternum and the esophagus, and it actually attaches to a back of a couple of the ribs too. And then that continuous attachment from the esophagus through the diaphragm blends into the psoas, which are our hip flexors, and so on and so forth. So yeah, it's a continuous system, and you're right. There's like this super cool MRI image of when we breathe in, right, and that diaphragm drops and our ribs expand, but how all of our organs start to drop and what happens through the cranium. It's fascinating stuff. We are just one continuous structure, and that we don't give enough credit to. Mm.
Fabulous.
Yeah,
Beth,
I love that too.
you and I could talk all day, but we're not going to, because we just want someone that's listening to do the two tests, which
Mhm.
is turn to see how the freedom of movement is, and the second was feeling for the whether there's some ribs that are sticking out or a little bit more tender, and they've got two really simple methods of retraining the body to see if we can get a bit more opening in those rib spaces. Thanks so much, Beth.
Yeah, my pleasure. And I think at the end of the day, as with I'm sure all of these talks is, these are tidbits, right? So if that helps, great, great, great. And if you're just getting stuck or frustrated, then reach out to a physiotherapist, occupational therapist in your neighborhood to get more hands-on help.
Yep. And I guess the other thing is, if the person that you're going to is not talking about ribs,
Yep.
then just
Yep.
Google more, find that
Yep.
person,
Absolutely.
find that
Absolutely.
person.
Yeah, because we need to be talking about ribs. We absolutely do. Yeah.
Fabulous. Thanks so much, Beth.
My pleasure.